Hi, this is Dr. Bob Dannenhoffer. I'm the Douglas County Public Health Officer, and this is another of our Facebook Live videos that will help to explain some of the difficult things to explain about COVID-19. We're going to talk today about how to decrease the spread of this disease by staying at home, by using social distancing, and wearing masks. Now, COVID-19 we think spreads to about 2 to 5 people per case. So that is a disease which is moderately contagious. For example, flu only spreads to about 1.5 people per case. So COVID-19 is relatively contagious. We can see from this little cartoon here how it spreads. So if we have this person who's the index case, you can see within one generation, which is about 5 or 6 days, you've got a bunch of cases. And by the time you've gone a month, you could have as many as 30 cases from one sick individual. And thus, it's really important that we decrease the spread of illness to other people. Now, most people will spread between 2 to 5. Now, some people don't spread at all. Some people, for whatever reason, are not particularly contagious, or they've stayed at home the whole time, and they wouldn't be expected to spread it to anyone. On the other hand, some people seem to be much more contagious and are known as super spreaders and can spread it to 50 or more people. Now, people who stay at home are going to generally spread it less. People who are going to be out more are going to generally spread it more. And so we'll look today at how we can go ahead and decrease the spread among the contacts. So in the morning, I would say goodbye to my wife and give her a kiss and be gone to work. I would then go to breakfast and sit right across the table from my friend and about 2 feet away from the person at the table next to me. I would then go to a doctor's meeting with about a dozen other doctors, and we'd sit for an hour and talk about some medical issues. Then I would do some phone calls. Then we would have a team meeting to review some projections. And then a few of us would sit around a small table and have a meeting. Then I would do some phone calls. After work, I'd go to spin class with the bikes about 2 feet apart. So now let's look at a day with social distancing. So in a time of social distancing, I would still kiss my wife. I would still have my bagel, but I wouldn't sit down to eat it. We would have the provider meeting by phone. So I might do part of the team meeting virtually. We might still have our lunchtime meeting, but we would certainly socially distance. And I would still exercise, but all by myself. So on that first day, before I knew I was sick, I would likely spread this disease to maybe 10 people. Now, it's interesting that even though I had about 15 close contacts, you don't spread it to everyone, but likely I would have infected 10 people. If I went to work the next 3 days, I likely would have infected another 30 people for a total of 40 infections. Now, if I stayed home as soon as I felt sick, I would have only spread it to 10. If I stayed home as soon as I was sick and socially distanced, I'd probably only spread it to 4. And if I stayed home when I was sick, socially distanced, and wore a mask when I was in public, I'd probably only spread it to 2 or 3. And if I stayed home the whole time, I likely would have only spread it to 1 person. And thus we can see how very important it is to stay at home when you're sick, socially distance, wear a mask when you're in public, and if at all possible, stay at home. Again, this is Dr. Bob Dannenhoffer, Public Health Officer for Douglas County. Thank you. And I'd like to thank my granddaughter Evelyn for making those adorable avatars. Thanks, Eddie.